Moving on to other news today, the San Antonio City Council wants more specialized mental health resources after a woman was shot by officers in June. 46-year-old Melissa Perez was said to be experiencing a mental health episode when SAPD initially responded to her apartment. But can those resources be available 24/7? KENS 5's Andrew Moore explains. Andrew?
Yeah, San Antonio currently has a specialized team to handle mental health calls, and SAPD actually has 20 officers in a mental health unit. But most of those resources actually clock out by 11 p.m. Melissa Perez had a mental health crisis in the early morning.
Where are we in terms of being able to respond with SA Core in the event there's a mental health call in the community at any hour of the night?
San Antonio already has one specialized SA Core team to respond to mental health calls. That team has a police officer, EMT, and a clinical professional. And if the team is busy, SAPD also has mental health officers.
We have a mental health unit, but if one is not available, then a patrol officer would respond.
But police do not have the staffing to keep a mental health unit on standby all night, so they have one on call. When Melissa Perez was having a mental health crisis in the early morning, patrol officers responded, and unfortunately, Perez was shot.
Obviously, with the incident this summer, this is a big focus of our activity.
But adjusting resources can be difficult. The council is now adding 2 additional SA Core teams as of January, but those teams will also work during the day when mental health calls are more common. Police say that may be the best they can do right now.
I wish I could have 10, 12 teams, enough, to go around the city.
But some council members say they still want to see a dedicated 24-hour mental health team in the future.
It'd really be nice to see a number of what would it take to get this service to be 24 hours.
And the department is also adding 105 officers in that next budget. SAPD did tell me today every patrol officer gets training in crisis intervention so they can handle cases such as these. BC's.
All right, thanks so much, Andrew.